Mekelle Hospital is the second largest hospital in Tigray, and it uses to deliver service not only to the people of Tigray but also to the people of neighboring regions of Afar and Amhara. However, due to the termination of critical services such as banking, telecommunications, and transportation, coupled with the ongoing siege that blocked food and medical aids from entering Tigray for 11 months now, the staffs of the hospital are facing a lot of problems. Sister Autasholdu is coordinator of the emergency case team at Mekelle Hospital. She said that life for health professionals nowadays is extremely difficult as they are forced to work without salary and transportation.
ህይወትና አና በተለይ ለሰማያ ሕክምና ብጣዕሚ ከቢድና አጸጋሚ ዝሆኑ ለሰዓት እዩ ምክንያቱ ዓዊ እናትና ዓዊ ጸገም ለሎ ትራንስፖርት እዩ.
Life these days is extremely difficult and impossible, especially for health professionals. For example, currently, my biggest problem is transport. I came to Mekelle Hospital from a place known as Qilqal Dawri, and therefore I have to travel on foot for about an hour and a half to arrive in my office. By the time I reach the hospital, I'm already exhausted. What is worst is I couldn't even help my patients properly as all the medical supplies are depleted due to the ongoing siege. As a result, we couldn't help our emergency patients as we don't have any medical supplies at hand. So our current life is very problematic and sorrowful.
Gidena Hidago is one of the supportive staffs of Mekelle Hospital. Although she is pregnant, she has the obligation of attending at her workplace every day, traveling on foot from a very far place as the hospital is unable to provide transportation service at the moment due to lack of fuel.
بتعم خبيديو إيدينو عليه وكان زي حدر مدحني تسينه سأن قرش مجزء سأن زخنا نجر صقيلني أخو قرأ تغنزخو.
My life is becoming so difficult nowadays. I'm experiencing pain at my hand and my leg, but I couldn't be able to get medication as there's none at the hospital, and I couldn't afford to buy from private pharmacies. Not only that, I couldn't be able to eat what a pregnant mother should eat because my salary was terminated for over 10 months now. So it's very difficult. We all are living under a harsh siege.
According to Froini Germay, a nurse at the medical wards of Mekelle Hospital, the life of Tigrayan health professionals at the moment is very difficult even to describe it in words.
نابرا بطعمي لمن نقارا تقامي وتخلنا لقزي إني أحزي كبيدي بطعمي.
Our current life is impossible to describe it in words. What makes it very difficult is the existing starvation, and the long-distance health professionals are forced to travel on foot each day to come to the hospital. On top of that, here in this hospital, we have senior staffs with special needs, so our current condition is very severe.
Dr. Philemon Mesfin, Chief Executive Officer of Mekelle Hospital, said that health professionals at Mekelle Hospital are becoming victims of both physical and psychological traumas.
We can look at the pressure and trauma to our staffs in two folds or in two ways. One thing is the physical pressure and the physical trauma that they are facing. As I was mentioning earlier, they are being forced to come from so many far areas on foot. Of course, by the time they reach the hospital, they are very exhausted. They cannot eat. They don't have anything to eat in their homes. So this is the physical trauma that they are facing. Even being exhausted and being hungry today, they come to the hospital to serve to their patients. But of course, as you said, at the end of the day, there is no medication, even if they know what the illness. So when they prescribe the drugs, or maybe even most of the time when they order some laboratory investigations, they cannot be provided at this current situation in the hospital due to the siege and blockage. So on top of the physical trauma and the physical harm that they are facing, as a medical professional, I could say it's very agonizing to not treat and to not give care to your patient.
Currently, more than 6.5 million people in Tigray are found in a dire need of humanitarian assistance. And even the conditions of health professionals is harsher as they are obliged to help their patients even in difficult times like this.